That one, Debbie McGee. Okay, so I am going to try and show you how to set up the arterial line. Have a quick look at our HDU and have a look at what you need in regards to the monitors and all the equipment. Okay, so this is our HDU in Southampton. I'm going to do a quick whiz, excuse the cups of tea that you see, but we're gasping. So this is our bed space in HDU-A, and as I turn the monitor around, HDU in Southampton is a purpose-built 2-bed bay, and we care for approximately 3,000 to 5,000 women. No, we don't. I lied to you completely. We lie probably, I think, when I was here last, we care for about 500 women in here a year. So 10% of, just under 10% of the women that come into Southampton actually end up in HDU. We take them into HDU here for anything from a 1500ml pph to PET to sepsis to cardiac issues, cystic fibrosis, genetic disorders that just require the lady to have a bit more invasive monitoring. Generally, if you're a HDU midwife, I'm laughing as I say this, it should be a 1-to-1 or 1-to-2 patient care, but we all know the struggles with the service at the moment, and often we are stretched a bit further. So my biggest piece of advice, and I laugh as I say this because it wasn't in here, is make sure your HDU is stocked. Make sure that you have got a drip stand, make sure that you have got drip pumps, make sure that you've got all the leads that you need to go back into the back of your monitor, because there is nothing worse than someone coming in by ambulance because they're fitting or bleeding and they go straight into HDU and there is no equipment there. So make sure you've got everything to hand. Make sure your meows chart is up in HDU, ready to start recording their observations the minute they hit the deck, because that's what people will want to know. They want to know what they were when they walked through the door. Okay, so arterial lines. So the most important piece of equipment you're going to need is you're going to need a drip stand, you're going to need a pressure bag, and in this pressure bag I have got a litre bag of normal saline. You can use a 500ml bag, that's fine. Back in the olden days we used to use Hepsal, but it's now normal saline. You need to make sure that your pressure bag is inflated, and if you just remember, green to go, so make sure the bar on your pressure gauge is inflated up to green, which is 300, and therefore you'll get your good measurements. You're going to want your base plate, and this is the kit that comes with the pack, so it's all included. And we do know that Southampton has a different pack to pull. So in Southampton it's a closed system, we use vamps to take the blood, so there's no needles. But in Portsmouth, let me just show you, this is their system, works exactly the same, but it's not a closed system, and so it will need a needle to, you need to be able to attach a syringe onto your arterial line. Most importantly, as you can see, this, the Portsmouth one has been labelled. Okay, so people know that it's an arterial line. It's also got a red line, which is always very useful. Okay, so I'll go through the monitor. These are our dash monitors. You will only get an arterial screen once you have plugged it in, and it is the red plug on the side of your monitor, and it's the same regardless of what dash monitor you have, it's red. Okay, so to zero it, you need to make sure, let me just angle you down slightly. You will take the cap off the end, open it up to the air, make sure it's off to the patient, and then if you come back up to the screen, we go to arterial line, zero all pressures, and if you can see it's zeroing, and we've got 0, 0, 0 on the line. Okay. So on these monitors, and I appreciate they're fairly new, your arterial line will be the red line that comes across. These are your measurements, and you want to make sure that your line and your peaks and your troughs come in between this, in these levels, not above it, not below it, not too peaked and not sluggish, a nice looking waveform. Okay. Okay, so we just grab a vamp. So with these closed systems, what's really useful is that you can take arterial gases, and you can take normal bloods and blood cultures without having to additionally stab the patient. The most important thing I always try and remember is to use the vamp that's the closest port to the lady. Therefore, you're not having a large area that is of potentially contaminated blood. It would be clean blood that you're taking straight from your artery. Bear with me because I've had to use fake blood, which is in a bottle on the floor. So this is my lady. Here's my bottle of Volvic, okay? So what you're going to do is use an alcohol wipe, clean gloves, alcohol wipe. You're going to clean the port that's the closest to the lady, okay? While that's drying, what I tend to do is draw back my syringe. So with these systems closed, you draw back your syringe. As you can see, I've got blood filling my syringe currently. Okay, that will lock in place. And it means that the blood that is at the port doesn't have any normal saline in it. It will be fresh blood straight from her artery. Okay, this little gadget is a vamp, okay? And that's the port that we need to take the blood from, okay? So what you need to do is you can, place your vac container into the port at the end, pop your vamp on your now dry, clean port, pop it straight in. And that way you can fill all your bottles up, and they will automatically fill. Obviously they're not, because it's not a pressurised system at the moment. Okay, you can swap both your bottles, put a new bottle, put your blood gases on if you need to. If you need to take blood via a blood gas syringe, remember, take the vamp off, because if you leave the vamp in the port, the pressure from it means that you'll get blood shooting out the end of your vamp. Never good. So what you need to do is put your blood gas syringe onto the vamp, and then you can draw back off with your blood syringe and take the whole unit off together. Okay, that way it's clean. So I then clean the end of my port. You're then going to push the blood and the normal saline back through, warning the lady that it's probably going to feel quite strange in her arm. And then what you need to do is flush the line. So there's a little valve here. I'm not sure that you can see it particularly well. But what you do is you pull it, and then as you pull it, water will come down from your port up here, and it will clear your line. So we've got no more blood. You watch. There we go. The blood is now clear, and this is now clean, normal saline line. Okay, and that's how we use arterial line. You'll find that your readings on the top alter, but should go back to normal. If you find that it doesn't go back to normal, you're just going to need to re-zero it and start again.